Student Cultural Center. I'd like to welcome you to this spring series of Black history and Black activism in Brazil and the United States. I'd like to first thank our sponsors, who are the Center for Latin American and Caribbean Studies, Center for Global Health Equity, the Black Student Cultural Center, and the African Diaspora Studies. I'd also like for you to mark your calendars for our last presentation, which will be on April 8th at 2 p.m. And our presenter will be Rick Banks, who is an organizer and activism, and also a former student at UWM. And so I would like to introduce Professor Gladys Walther from the African Diaspora Studies. Thank you.
Thank you, Victoria. So welcome, everyone. I have the great pleasure of introducing Dr. Fernanda Barros dos Santos, who is located in Rio. And she received her Ph.D. from the Federal Fluminense University, and she teaches at the Federal University of Rio. She has also authored the book, Race and Class in Brazil, and she has also authored a number of other articles. But I also want to just mention a co-authored article that we have coming out, apparently supposed to come out next week. I keep checking on this, but it's the Journal of Cultural Dynamics, looking at Afro-descendant women's social welfare beneficiaries in Brazil and the United States. And Dr. Santos has done some work looking at social welfare policies, and she also does some work on human rights. So I look forward to her presentation on Black feminism and Black mobilization in Brazil. Welcome, Dr. Santos.
Good afternoon, people. Thank you very much for the invitation, Dr. Gladys. Thank you very much, Dr. Victoria and Rachel, for all the support. It's a pleasure to be here with you. So today I will talk about Black movement and Black feminists, but I will try to speak more about the pandemic situation for the Black community. So Rachel, you can put the slides, please. We have a movement in Brazil. The Black movement exists since 1933. Right now, they are getting more and more famous all over the world. We have the Black movement unified between all the states since 1970. And now we have a movement that we say, Vidas Negras Importam. It means like Black Lives Matter. See, so it's over historic fight all over the world, but in Brazil, we had that war started in Brazil in February 2019. We have the death of the Black community by the COVID. 100,000 people dead in periferia and favela and ghetto because they were working, they were this as essential service like domestic housekeepers. All of them were going to judge their jobs every little day, domestic service, so nannies, all of them were Black. And during this time, they say stay at home, but the Black people couldn't stay at home because they have the financial crisis as a problem. The Black movement are fighting for this agenda of difference of income between Black and white such a long time. Was not a contemporary fight. It's a very historical agenda. Because in Brazil, the states say that we don't have problems of racial. We live like in a racial democracy. But in Brazil, the races is about skin color. The more darker you are, skin color, the more races you suffer. And the job market, you have a difference of salary, of income. So the Black Lives Matter, Vidas Negras Importam, happened in Brazil in the same time as United States. The Black community was more afraid of dying on favela because of the low income and because of the violence from the police, from the state, than the pandemic in itself. For example, a house in Brazil of a Black person, usually they live with 3, 4, or 5 people in the same house. They don't have the right to have a distance between each other. They live in the same space all together, most of the Black people in Brazil. And the living areas, they don't have water to wash their hands or take a bath or clean the house. So in this way, they're claiming for help from the government because the government doesn't take care about it on that moment. The president says a lot of stuff like, don't stay at home. You need to go out and work. Just elder must stay at home, but you must go out and work. So the Black movement during the pandemic is since April and February, they go out, fight for the agenda that is not an actual agenda, it's a historical agenda. And the death of the youth by the police. All the youth, they are killed inside the periferia, killed inside the favela. We have a lot of names of intellectuals, Black feminists, like Lélia Gonzalez, Matilde Ribeiro, Luisa Barros, and other Black feminists that are claiming the life of the Black community. But the state never listened to us totally. Just some period before, during the working party, like Lula and Dilma, we have a special ministry that take care about the Black community. So the Black community, they are claiming, they are telling people all over the world about the deaths that we experience. And we have a case that makes the fight, the agenda more higher. The death of João Gilberto. He was a Black man that went to a grocery store and he had a discussion with the guys. On that moment, he was brutally assassinated by the security. The grocery store is Carrefour. It was the same moment of George Floyd death, occurred in the same moment of George Floyd. There was one case of police violence. And we have Miguel, and we have another kid, João Pedro, that was killed by the police inside the community during the pandemic. And we have the violence associated with Black women. Most of the numbers of feminicide or death of Black women was higher for the Black woman on these from 4 areas. So when we talk about the death of woman in Brazil, we are talking about the death of Black woman. This slavery process make the Black woman brutalized. They see the Black woman as just a body to be used. So their husband or partners, they used to kill and beat on them. Because of this, the feminicide increased during the pandemic because of an employed of men and more aggression against the Black woman, make the case even worse. And this agenda was really a big agenda from the Black feminists also. They are claiming the life of Black women. They are trying to say how difference of development on education, housing, security, all these stuffs are agenda for the Black feminists and the death of Black women. So they get together, they fight together against all these stuffs in the streets of Rio de Janeiro, São Paulo, Minas Gerais, and different areas from Brazil. The pandemic was just a point of view that showed all the inequalities between the death between Black and white, and the death of Marielle Franco. She was an important the councilwoman that fights for the Black agenda. So, and in this case that I told you, the assassination of João Alberto in the grocery store of Carrefour, João Pedro, Miguel, some little boys were arrested and killed by some people, and we don't know. And in Rio, we have an experience of militia. Is a group that work for the state, and they kill most of the people in peripheria, and they ask for money to pay for housing, electricity, gas. They ask for more money than the state. So people that live in And this space, they suffer with militia. They're a group of military people, military force. You can see that here. This is a picture of the Black people asking, struggling for help and doing a protest during the pandemic. We are more courage to go out and suffer the consequence of pandemic than staying at home and waiting for the virus, because the states are killing much more the Black people, us, than the COVID. Rachel, you can put the video, please. And before she put the videos, we can analyze that races. Oh, that's it. That's it. We use the same label like Black Lives Matter, like Vidas Negras Importam. There's a video there showing the protests in Brazil, how worked in Rio, a march that took a lot of 100 of people that were not afraid of COVID, struggling for ourselves. So racism in Brazil is ideological phenomenon that encompasses a set of attitudes based on racial prejudice, discriminatory behavior, structural disposition, institutionalized practices that attribute negative characters to certain patterns of diverse and harmful social meanings to the groups to hold them, resulting in racial inequality. According to Lopez, it defines the rules of coexistence and social organization, and at the same time, the way in which institutions are organized and operated. According to this author, Lopez and Quintilano, in Brazil, a phenotypic classification prevails, and the darker skin, the greater incidence of races, and the worse the health indicators. Skin color is therefore the variable used for analysis of structural racism and for the formulation and implementation of health policies that address to the theme. So, and more one agenda of the Black community, the Black movement, and the Black feminists was the free system of health. According to the Constitution made in 1988 on Article 196, free system of health is a legal right for all Brazilians without discrimination of class, race, sex, gender, religion, skin color, age, or any kind of discrimination. So it guaranteed the possibility of all poor people go to the health system for free. But we have, in spite of this, we have a problem of quality on the health system. The racist, institutional racism still occur inside the health free system of health. The doctors usually they choose who will live or who will not. So there's an inequality difference of treatment between being Black and white. So it occurs before the pandemic, but with the pandemic, the numbers of infected people by COVID are more Black than white. And Bolsonaro, the president of Brazil, during the pandemic calamity, he did a decree number 10,503 on this period that intended to privatization of health system in Brazil during pandemic. So the civil society reacts against the decree above. So it's paused, but we don't know if still the free system of health it will continue in Brazil. So we can see that we have a lot of inequalities, difference between being Black and white by the race and structure races. And we can see like the health system operate according to the institutional races, in spite of the right legalized in the constitutional. And during this constitution and during this period, the president made a decree to finish the free system of health and tried to privatize the health system of the free health system in Brazil. So the Black movement and Black feminists fight against all this. Right now in Brazil, we have, according to the researchers Fiocruz, we have 2.8 thousand of people infected of COVID and dying. I'm sorry, 2.8 thousand of people that died from COVID. We have a huge numbers of people dying from COVID. And we have related it on the next slides, the next please. we have the number, we have the graphic in Brazil. We can see that Amazonas, specifically the state of Amazonas, the number are getting low, but the high number are still in Acre, Alagoas, Amapá, the north side. There's still high numbers of people die and get infected. And the hospitals right now in Brazil, as you saw in Manaus, they don't have oxygen. They don't have the tools necessary to make people breathe. And the capacity of their hospitals are very high, are very low to receive people infected or dying by COVID. So it's a huge battle for all the Brazilian, but most for the Black people. The entities, the Black movement, the Black feminists are working together to help each other and to help with this calamity. Brazil, we have on this area of Manaus, the new variation, the cepa 1. So it makes more stronger the COVID and overspread the country. And the vaccination, you see during my presentation that the vaccination are going too low. So we are getting more infected and dying, and the government is not doing a great job on vaccinating all people in the country. We have some numbers here that shows, according to the research, that shows that the number of the death of COVID in Brazil, there's a huge difference between Black and white. In April of last year, we have 3 times more death of white people compared to the Black people. The Black people on April, in the beginning of the pandemic, they died 5 times more compared to the white people. So as I said, the government said we have essential service like domestic server, bus driver, saloon, gym, all these service are the majority of people that worked on this area are Black. So that's why they get more contaminated with COVID compared to the white people. And the home office was just a job for the middle white class and high class. So the effects of racism is even worse for the Black community. And the government didn't show in the statistics, the difference between Black and white people. They hide the numbers of deaf people and infected people on the hospitals, in the hospitals. So the absence of race and skin color mortality by the government was modus operandi the government not to show the racial inequality. Batista and author say like the chance of death between a Black and brown person patient is 3.8 times greater than a white patient with higher education. It's 19.6, confirming the huge disparities in access and quality of treatment in Brazil. The author noticed that 30% of reported cases present information about race and color as ignored. The data show that 55% of Black disparities hospitalized with COVID in serious condition died compared to 34 or patients white. As I said, the problem of racism, institutional racism, make some doctors also to show one life between the other. So there's a huge problem in Brazil before the pandemic, and it get worse during the pandemic period. So, and higher education, usually higher education, middle class in Brazil, they are white, and they have access to a health system of quality, the private system. So that's why the experience of health in Brazil system is different, and the health system for free. They have problems of apparatus of medical support too. So the government didn't show the numbers as was done in the United States by state. In Brazil, they hide the numbers, but the Black community and the Black feminists, and not only these researchers and other doctors and the university, they did a huge they did a huge job showing the numbers of the inequality between black and white. As I said before, 67 percentage is the primary use that depend of the free system, black and female. Most of them, they are free health system free dependent, and most of them die also for free system by pregnancy, high blood pressure, diabetes, and pneumonia. Most of them, they have this comorbidity on their bodies, so they died before the COVID, and they get the numbers increased because of this. And we have numbers of the Institute Police. It's an NGO in São Paulo, county São Paulo. They observed the standardized mortality rate of white people was 150 deaths per 1,000 residents. And for the black people, we have 172 deaths for 100,000 residents, revealing a difference for more than 57 percentage points between black and white. It's just a case to say about São Paulo, the county of São Paulo. So the percentage between the difference between black and white of death is 57 percentage for black people. And São Paulo is a capital where people are very rich. It's the most developed county from Brazil. So the disparity, the inequality between being black and white is even worse. So Black Lives Matter raised the issue of police violence. They claim how the police operation was huge on Rio de Janeiro, not only Rio, but other states of Brazil, how the police operations killed more than COVID. So the process take this agenda together, and they claim, they appealed to the Federal Supreme Court to minimize the effects of the police operations. So according to the IGPF number 635, the Supreme Court give the right for the black community, the poor people, not let the police operations go into the favelas during the pandemic, trying to make the numbers of the facts of the brutality of police decrease. So in this area, we can see that our black feminists, they say like the youth, the death of black youth are still high in favelas because of they don't have education, they have bad conditions of life, and they accuse the black people, the black youth, being thieves, all criminals. The police say like they are all criminals. That's why the violence are so high compared to the white youth. So in Brazil, being black and youth, you have 5 or 4 times chance to be killed by the police than a white boy. So we are talking about race, class, territorial, we are talking about sexuality. There's still a target for this kind of violence did by the state, and not only by the state, did by the white people. So in this way, the black agenda tried to show, was not only trying to show, but was fighting against all this kind of subject. Sorry, the PowerPoint stopped here. I'm really sorry. So the black agenda, the black feminist was fighting since 1960 for some kind of better conditions for the black community. But in spite of all this agenda, the pandemic proved how the difference between being black and white during this period was harder for us, for black community. For example, using masks was really a big deal for the black people because they even have money for food. The numbers of unemployment in Brazil are still high and is getting more and more high. And the president claim is the problem because of the lockdown, but the vaccination is not working as the different countries and in other countries from the world. In Brazil, the vaccination is going step by step. We show you after the plan of the government, the Ministry of Health, they didn't have a target to start vaccinating. They didn't have a plan, and now they're vaccinating only elder with 75 years old. And today, right today, they're just vaccinating women with 73 years old. So they don't have a strategy of fighting against the COVID and vaccinating all the population, all the people from Brazil. So the violence against the community, the police violence was a problem too faced by the Black Lives Matter, by the Vidas Negras Importam, the Black movement, Black feminists that they claim since 1960. And as I said, in Rio, a lot of actions appeal by the Black movement and social party too against the police violence during the pandemic. Like in Rio, we have the Court of Justice that they did. They appealed to the Supreme Court another law against the violence inside the Black communities. So the Supreme Court gave a good answer for them and tried to and said that police could not go to the periferia, to the favela to do operations like they claim. As we can see on the graphic on the map of Brazil, you can see that the red area is represents the state of Brazil, that the situation are very high, that the numbers of people dead are very high. So the north and the center, the southeast, so all these area are people infected and dead from COVID. We have an average now of 2.8 people death of COVID per day. And if you can see on blue area, this is Amazonas. We have indigenous and Black people there. But on that place, the inequality between Black and white are very high too. The difference between them are very high too. So it's the area where they have no apparatus to breathe oxygen. And if you see the yellow areas, Bahia and Roraima, these two areas, the numbers are stable. So we are under control, the people that are on hospital, but it's very critical, the situation in Brazil. Most of the governors are trying to put the lockdown, but the executive power is telling like we should not stop working, we should not close the states or the activities, the economic activities, because Brazil will not die from COVID. We will die because of economical financial crisis. But in spite of this, people are afraid. They don't know what to do exactly. If they work off this, they stay home. And I said, how I said before, the numbers of people that's really dying more than the others is Black people, usually women, and they're usually also unemployed. You can pass, please. Next, please. So the minister, as I said, the Supreme Court, the judge and minister of Supreme Court, Edson Fachin, he published a law forbidding police action inside favela during pandemic on November 27. In spite of this, the Black people are still, you see there's the difference between the pink area is the death of white people, and the brown area is the Black people death. It's April of last year, this number. If you can see like the pink area shows like white people, they have 3 times more of being of dying from COVID, and we have 5 times more deaths from COVID. So it represents the Black people. This data is from last year, 2020. You can pass. And as I said, the higher education makes more affordable to survive during the pandemic because of the income. Higher education people, according to authors of economics and education, they receive much more income, salary, so they can stay at home and work like home office. In Brazil, we have affirmative action that made some Black youth enter to the university during 2003. So affirmative action entered to the higher education. But still now, we still have few numbers of the youth that get higher education. And even now, the job market, they didn't allow the Black youth and the Black community go to higher positions on job market. The racism, structural and institutional racism make a big difference between being Black and white, even if you have a degree. So the possibility of a higher white person to die from COVID is less than a Black person with higher education because of discrimination and because of access to health. So during the pandemic, they did a research and they identified that between June and July of 2019 and 2020, the number of deaths by police operations fell by 25% because of the Supreme Court law that didn't allow the Black community, the police operations go inside the favela in São Paulo, Rio, Porto Alegre, and other areas. So after this law published by the Supreme Court, the numbers of death of Black youth decreased. The Black community and the Black feminists, they fight showing the disparity and inequality, poverty, and also the brutality of police. They appeal to the Supreme Court to reduce this death during police operations during the pandemic, and the judge, as I said, Edson Fachin, he published a law forbidding police actions. The director, he approved a credit of 19 millions of reais for to the penitentiaries. So in Brazil, we have a mass incarceration. It's a huge problem like United States. We are the third country with mass incarceration. And most people inside the jail, they are Black and poor, even white, but if you are white, it's just because you are poor. But most of them, if they don't die on periphery, they die inside the jail. So during this moment, the human rights, they claim, they advocate in favor of the prisoners. And the government gave 19 million reais for the penitentiaries. And the director, he made a public policy of buying grenades. He bought a lot of grenades just in case of protests from the families outside the chance penitentiaries because of COVID. So he bought a lot of grenades because he was afraid of families of prisoners come to the penitentiaries asking for getting the prisoners free or to see them because of COVID. So the number of COVID inside jails, prisons in Brazil are very high, but we don't have numbers of infected and dead prisoners because the government is not given numbers about that. So DEPEN is the name of institution that control all the penitentiaries in Brazil. So they received 19 million reais, and they bought grenades just in case of protests of families of prisoners to go and try to save or to say something against them. So we don't have numbers about gender, race, and comorbidities between the prisoners. They don't show any kind of numbers about prisoners in Brazil. But according to National Council of Justice, the numbers, they reveal like 308 are affected prisoners and 250 dead, and 39% of the military force that working prisoners have died in Brazil. So mass incarceration We can say that prisons in Brazil are precarious repositories of people in which not only the experience of inferiority and political and social exclusion of Black people is updated, but also a space in which the risk of death, both physical and symbolic, expands of these people and their collapse from a political and subjective point of view. So it's similar for the United States. You have Rick Vacan that he talked about the ghetto in the United States, like how the welfare state is getting short, is decreasing, and how neoliberal project as a public policy is growing up with mass incarceration. So policies of raising jobs and health and food and housing are getting very low in Brazil in this period of time. Mass incarceration is like an objective plan from the government right now to finish the poverty in Brazil. So we can say like all people incarcerated in Brazil, they represent political prisoners. And there was also a movement of incarceration or criminalization of social movement. The president says like the Black community, we are trash. All we say is trash. And they deny that there's races in the country. They say like we are indigenous and Black and we are mixed and we live in a peaceful and harmony way. They say like the difference by race, the difference of poverty and inequality doesn't exist. They say like we're speaking something that's not real. So the picture that showed before about mass incarceration, can you go back?
And Dr. Santos, you have 1 to 2 minutes.
Okay, so I'll go ahead. Anyway, thank you. I'll go ahead here. So about this kind of difference, we have transfer income urgency ad. There was a big dispute between the numbers of people that would actually receive the income transfer. So between the difference between Black and white right now, the rate of unemployment is more by gender. Women are more unemployed right now, and by skin color, the Black women are the highest number. So we represent right now around 20% of unemployed people, Black women, compared even to white guys, Black men. And the white people, they represent just 11%. So during the government of Dilma until now, the numbers of unemployment, the rate are getting even worse for the Black community. More brown and Black people are unemployed. And they, for intersectional studies, it represents women and Black. And talking about income transfer emergency ad, and the beginning of the pandemic, the government want to give just 250 for the poor people, but after discussion inside the Congress, the executive power together of the Ministry of Economy, they decide to give 600 until 1,200 for families of single mothers and so on. But right now, after a huge discussion, they decide to give just 150 for families of only one person, and 254 families, and 375 for single families. But if you compare the transfer income they are giving to poor people, and usually they are Black and poor, the food basket price in Rio and São Paulo are very high. The basket food in Rio is like 529, and in São Paulo is 631. So what they are given as a transfer income emergency ad and the food basket doesn't solve the problem. And even given this kind of benefit, the demands are more high than what they think. So even with this kind of emergency ad will not mitigate the impacts of a crisis caused by the coronavirus. And more one thing, they have a strong problem to access the emergency assistance because they don't have technology, internet, to do the registration. Usually there was 7.4 million Brazilian people that do not have access to internet. and they are poor and elderly. And payment was made after registration over the internet. So issues such as race, class, age, and gender are barriers to access because they don't know how to access the internet and the website to register themselves. So, and more one thing, 8.1 million Brazilians defraud and receive the benefit from federal government. So most of the pandemic, most of people during the pandemic that get unemployed was brown and black, as I said before. The workforce that was not occupied right now is 6%. And as I said before, most of them are women. And usually women, they work on service, domestic service, agriculture, and services. This is the area we can find black people in Brazil. And most of them, and as a domestic server and as in agriculture, men and women, but most of women are working as a housekeeper. So because of the poverty and security of food, we have a lot of black movements that are helping people from poor areas. For example, in Brazil, we have Kufa and Joe, we have Fala Cari, Coletivo Básico, Coletivo Coletivo Papo Reto, Conexão Favela e Arte, Maré 800, Movimento Caxias, SAP, União Coletiva, Fala pela Zona Norte, Crioula, Instituto Marielle Franco, Periferia Connection, Movimento Caxias, and others. All these NGOs are in black movements and black feminist movements are helping people poor, and they are asking for money in donation to help the poor people to buy a basket of food. So and about vaccination, the president said during the pandemic in the beginning, he said a lot of speeches encouraging people to use the mask and not getting away or not staying with 100 people together. He said, it's just a little grief. I have a history of athlete. Makes no sense to stay at home crying. Go to work. Brazil can't stop. People are killing themselves because of lockdown. People are committing suicide because of lockdown. Chloroquine is the solution to COVID. Appears many times, not using mask. The president appeared many times using mask, not only using masks and talking to 100 people on the street. And he said, finally, unfortunately, some deaths happen. Patient, let's keep moving on. And more on stuff that he did. And he bought a lot of chlorine production from the army laboratory. He spent 500 million reais buying chloroquine. And he changed the health ministers during 4 times. First of all was Mandetta, Dr. Nelson Tai, and after he put a military general, Eduardo Pazuello, and right now we have a Dr. Marcelo Queiroga. So he changed a lot of times the Minister of Health. And he did a competition between both him and the governments for election 2020. That's his plans for buying oxygen didn't work, and he didn't buy anything. That's why we saw the case of 307 deaths without oxygen in Manaus, and 7 deaths and 67,000 infected, and a lot of people helping people in Manaus. His plan of vaccination, there was nothing. When you see the report published on the website of the government, he said the target people they don't have. So the objective is fight against COVID, but he doesn't recommend any kind of thing. And right now, he's trying to do some kind of
medicine. Sorry, Dr. Santos. We're going to have to end the presentation right now. Mm-hmm. Thank you so much. I wanted to, with the little bit of time we have left, I wanted to ask you some questions, and mm-hmm. also if there are questions from the audience, we'll take those. So if the audience, if you have any questions, feel free to put those in the Q&A in the chat box. But I will go ahead and ask a couple of mine. So first of all, thank you so much for the presentation. I really appreciated that you put it in context so that, you know, we're talking about the Black movement in the context of COVID-19 in terms of the pandemic. So there are 2 things that I wanted to ask about. One you've already addressed. So I wanted you to talk a little bit more about the agenda of the Black Coalition of Rights right now. So that's the umbrella organization of over 180 Black movement groups. And so I know that one thing that they were fighting for was the emergency aid that you just mentioned, and they were advocating for 600 reais per month, but then the government proposed, I think 250 reais or something, I'm not sure. But beyond that, I wanted to know what are some of their kind of agenda items. And then the second question that I have is that, you know, the news came out, all of those charges against Lula were dropped. So of course, you know, many people already knew that, you know, that he was innocent. But I do know in the media, there has been more talk about him running in 2022. So since you have been focusing on Black movement activists, I wanted to know more about what you think Black movement activists, what they think about him running in 2022, like if they support him, if they support his agenda and things like that. So those are just the two. And more, since we are so short on time, I'm more interested in the second question. And then after that, I will look in to see if there are questions in the chat box.
Okay, I'll try to answer all your questions. I didn't listen very well the first one, but I'll try to synthesize about the Black movement, Black feminists. They have a big agenda since 1960 for the death of Black youth, poverty, difference of salary between women and men, and housing, the violence from the state, control, birth control, and did by the state, and the racism inside Brazil, and fight against the racial democracy. So we can experience that in Brazil. People are right now assuming themselves as Black, brown, or Black. So they're assuming more this. And you have a part of the Black feminists that work on social media, YouTubers, you have Instagram, you have more vocal women speaking out about the Black issue. And during the pandemic, they went out to overspread the whole entire world, how we are suffering because of the state. And we have the president of Palmares, the Foundation of Palmares right now, he's Black, but he's not pro-Black. He fights against us. He say that Black movement is not real, that what we say is not agenda, is not really exist. He's trying to say like the state of Brazil, he do the best for others. So we must work for the country and we doesn't need to speak out about race. So the Black movement are together with the Black families advocating because of the deaths of the youth. And not only this, because of unemployment and because of the crisis, economic crisis that specifically the Black people are suffering right now. I don't know if I answer your first question correctly. And they are using different channels like YouTube and Instagram and Facebook. And there are some enterprises, they're changing their behavior. They are hiding more Black people with higher education, because after the affirmative action in Brazil 2003, a lot of youth get the degree, the diploma, but in spite of this, the job market didn't get it then inside the enterprise. So most of them, like Magazine Luiza, they are hiding Black people. They create a job like a trainee just for Black people. And the white people and the racist one, they say is not fair. And they did a lot of measures, judicial measure against this enterprise, Magazine Luiza, telling that Brazil, we are not equal, so is racist reverse, like we are creating something that's not fair. But the Black movement gives support to the enterprise and gives support to all these marketing, all these firms that are changing things. But right now we have a still really a huge problem in university. We have some outside and inside. Some students, they are Black and some are white, claiming that the affirmative action is not good because it makes easier Black people go inside the university. They don't need to study too much and go. But all the problems that people try to avoid or to hide talking about Black people, we have more visibility right now. People are more conscious watching TV. But in spite of this, we can see many barriers that are still going on. And the racial democracy is still a subject that people use to hide the difference between Black and white. You said, sorry, can you repeat again?
Yeah, so the other question is, I wanted to know more about what Black movement activists think about Lula running for office in 2022. And then there was a question in the Q&A where somebody just wants to know if your slides will be available. And so for that person, I'll just let them know that this, the presentation has been recorded. So it's on the UW-Williams African and African Diaspora Studies Facebook page. So that is where you can access it. So if you can go ahead and just answer the question about Lula, and then after that, we will close out.
We have a division, in spite of Black people in Brazil are assuming being Black, brown and Black. We have a huge separation between this political ideology. We have some Black people that they are affiliated to Protestantism. And Protestantism here in Brazil say like the president is right, everything he does is right. And these Black people usually they are working class and they live on poor areas when the criminal violence is too high. And so they think that militia and the president are helping them to have security and peace on their communities. Actually, they do, but in the same way, they ask you for money for this type of job. So they don't experience their Blackness totally, and they see the president like someone is taking care of them, and they don't see like race, skin color is a problem. So the higher education Black community, they are more conscious about the Blackness and the racism. So they are pro Lula, and they understand like the Supreme Court didn't prove enough. They didn't show all the proof that Lula was guilty for the corruption. So they see not only Black community from high education, but white middle class with high education from the left. They are giving support to Lula for election. But the political sinner is very confused because the Supreme Court didn't say he's allowed right now. They didn't say nothing about him running for election. But after his speech, the president Bolsonaro said like he did a lot of change on his behavior. He used the mask. He stopped talking about use chloroquine. He said like you're gonna vaccinate him, but he's still affirmed for not locking down. He changed his way of acting symbolic. He changed the Minister of Health for a doctor, but they're still talking like he's still making confusion on people's mind. And there are some Black politicians inside the government that they affirm that Bolsonaro is pro-Black. They affirm that Bolsonaro cares about Black people. So the high education Black community or inside the university, they're more conscious about the picture of Lula as someone that can really help the Black community to get out of the poverty and all the pandemic situation. But the society is completely divided. For example, right now, we have numbers that people that are still in doubt for impeachment, they say like 57% of people from Brazil, they are against the public policy applied by the president, but they're still in favor of the president in power. They don't want him impeached. So it's really divided the population, and the Blackness, they have some kind of link with religions, and the religions give a lot of support for Bolsonaro. And about many leaders from Universal Assembleia, they give a lot of support to Bolsonaro. So this working poor class Black, they have support to Bolsonaro, but sexual Black and higher education people, they are more in favor of Lula. And Lula has a huge capacity of changing the scenery again. But we have a dispute inside the elite. So we have financial mark giving support to Bolsonaro, but you have the class of industrial, the guy that corporation that has a little sign in favor of Lula.
Thank you. So there was Diva Morea has a question. Do you have information on Blacks and fundamentalism, those who still support Bolsonaro and are Black? And I think you kind of addressed that. And when they say fundamentalism, I think they're talking about evangelicals, Black evangelicals supporting this is a question that's in the Q&A. And so I think they're asking about Black evangelicals who support Bolsonaro. Like, do you have information about that?
Yeah, I don't have numbers, but I have read in the news some stuff and some research. They affirm right now, like the Black evangelicals, usually from the periphery, from the ghetto, they are most of them criminals that change their lives into someone not more criminal, drug dealers that they became like a cidadão do bem, just in case, and they're fighting against the religions of African. So they are beating and spanking and killing some icons of religions of Africa. And these people, fundamental now Pentecostalists, they are against any kind of racial identity. If you say it's not right what he's doing against the Black community, they say you are going against the God, you are selling stuff that doesn't exist. So they see the president as a savior and they don't see color, even being Black. And most of them are men, and they receive not too much, but there's some appealing for the chauvinists. Most of them are men, and they fight, they attack the African religions, and they attack also people that say that the poor people and Black people are suffering more. So attack with words, they are more violent, and they really attack physically also them.
Okay, thank you. So we are going to go ahead and end here. Thank you for everyone who attended. If you're watching this later in the day or later in the week, thank you for watching. Thank you again, Dr. Santos, for joining us. I hope to see you, if not in Brazil, then, back here in Wisconsin. So thank you again. Thank you for everyone who attended. And we will see you later, hopefully in April.
Thank you.
Bye.
Thank you all.
Thanks.
See you.